Here in Canada, we are extremely privileged to have free healthcare available to us virtually all of the time. From broken bones to a sore throat and the most urgent of emergencies, we are provided with quality healthcare across the country. No matter where you live and no matter who you are, as a Canadian, you are provided with quality healthcare. But imagine that this privilege of healthcare was taken away from you. No checkups when you're not feeling well, no life-saving surgeries, no smiling nurses to help you recover from whatever you are going through, no flu shots, no anything. Unfortunately, this is what the majority of the population faces in India. In the country of India, about 70% of people live in rural areas. And with 80% of India's healthcare facilities located in urban areas, most of the population has no or limited access to hospitals or clinics. Healthcare in India is universal. However, there is great contrast between the healthcare found in rural and urban areas of India. Lower-level public healthcare facilities often suffer from a variety of problems. Some of these problems may include worker absenteeism and dual public-private practice, low demand for their use, and shortages of supplies and staff. Many public healthcare services are poorly resourced and fail to meet the needs of an expanding population in India. As many major public health challenges come into play in India, like those of cardiovascular diseases, cancers, diabetes, chronic respiratory diseases, and mental illnesses, plus the infectious diseases now including HIV/AIDS, health systems are stressed beyond their capacity. Consequently, the private sector of healthcare in India grew. But these private facilities don't provide basic healthcare to the majority of the rural population or to those who are poorer living in urban areas. And even private healthcare varies greatly in quality of care. Some facilities are unregulated and financed largely through out-of-pocket payments. In the private sector, there are a large number of health workers who have only a high school education or don't have even a medical degree. Doctors are an essential part of healthcare, but India faces a 64% shortage of doctors. The contrast between healthcare in urban and rural areas have many consequences on the population of India. 43.5% of children are underweight in India, which is the highest percentage in the world. Life expectancy is only 63 for males and 66 for females. The infant mortality rate in 2012 was 43.8 deaths per 1,000 live births, while here in Canada, the infant mortality rate is just 5 deaths per 1,000 live births. 31% of the rural population travels over 30 kilometers for medical treatment. 66% of the rural population lacks access to critical medicine. With only 5% of the population having healthcare insurance, many Indians pay for healthcare out of pocket. And this lack of adequate coverage by the healthcare system means that many Indians turn to private healthcare providers. But for the poor, this is a generally inaccessible option. Rural areas also suffer from the lack of basic amenities, such as electricity and appropriate drainage and sewage, which further contributes to poor hygiene and increased susceptibility to diseases. Healthcare in any country should be a priority to ensure that the lives of every single person are held with value. Pope Francis says, "All life has inestimable value, even the weakest and most vulnerable, the sick, the old, the unborn, and the poor are masterpieces of God's creation, made in His own image, destined to live forever, and deserving of the utmost reverence and respect." The poor and less fortunate have a claim to special consideration. The richer class have many ways of shielding themselves and stand less in need of help from others. whereas the poor have no resources of their own to fall back upon and must chiefly depend on the assistance of others. We are called to show love and compassion to those who are less fortunate, especially to those without access to healthcare in India.